My name is George Dobson. I live in Lancaster, and I live just around the corner from the college.
All right, so if you could summarize your image of nursing into one word, what would it be and why?
Overall, wonderful. Nurses are a big factor in a person getting their treatment properly and getting well. It also takes the patient to have a good attitude of what's going on and how they respond to the kindness of nurses and the tough love of nurses, because I've had some that tell me, look, you probably not understanding why you were in here in the hospital, and you're going to suffer before you get well. In other words, you got to be tough with people that want to continue to get like pain medicine. It's got to be a stopping point to that kind of thing. And nurse plays a big role in that.
Tell us how an interaction with a nurse has made a difference in your life.
Well, I had a nurse when I was in an accident in 1955. I was more or less pronounced dead, and when I got to the hospital, they couldn't hardly find a pulse. But this nurse, and I wish I could remember her name, because this happened in 1955. She said, I started to work on you and gave you blood transfusions, and you come around. And she took a lot of interest in me while I was in the hospital. And that means a lot to the patient, and the dedication that she had to do all she could to take care of me. So I'll never forget that.
And do you have any recommendations for future nurses?
Well, of course, hard work is in everything that you do. But try to develop a good, or have a strong attitude of the profession of nursing. Also, work real hard to get along with all types of people, because a nurse is faced with all kinds of patients. Some want to get well, some just give a nurse a hard time, and you got to be able to handle that and handle it in a tactful way, because as you know, you take, I think, an oath that you're going to do, everything you can to make people better and so forth.
Would you say self-care, like being able to take care of yourself after surgery, like when you had your knee surgery, was it harder than like when the nurse came in here and tried to teach you how to take care of yourself? Was it frustrating, or did she make it easy for you?
Well, recently I had the knee surgery, and I had hospice come in on a weekly basis, and they interviewed me of how I was doing and so forth. They also taught me how to give myself a bath, because I couldn't hardly get in a shower, and they helped me do all those things. So, I mean, it's just a big help to have somebody that can teach and are readily available to help you, whatever your needs may be.
And do you have anything else you want to add?
Well, I think if nursing is one of the most noble professions that you could even achieve, and I hope that y'all all stick with this, because it'll mean a lot to you in life, not only for your financial benefit, but for the education of it, and the fact that you're helping people, because that is the biggest responsibility a nurse has, is to try to help people get well.
Sir. Well, thank you.